You grew up in Scotland. Why did you decide to come to the US?
So I was actually working as a junior doctor in Scotland, finishing the equivalent of internal medicine residency, and I became increasingly aware of the role that systems and processes played in care delivery, and wanted to impact those, but I didn't really have a skill set for doing that. And so I was actually very fortunate to get a scholarship to come to Harvard Business School, and that's what brought me across to the US.
One thing people may not know about you.
Before I went into medicine, I was a school teacher in Tanzania.
What person has had the biggest influence on your life?
Probably the person who's had the biggest influence on my life is my sister. She has a profound developmental disability. And so from a very early age, I had a lot of exposure to medicine, because we went to the hospital a lot as they tried to figure out what was going on for her. I got a lot of experience around how society treats people with disabilities and the families of people that look after folks with disabilities.
What image is the background of your phone?
The view from my childhood home.
What inspires you?
I'm inspired by people working together to shape and have impact in communities. And so that's actually something that I find particularly inspiring about BMC. When we hit events or crises or opportunities, it's how the broader team kind of comes together and acts together in service of others.
What's the most challenging thing about your job?
The most challenging and rewarding thing about my job is helping BMC live up to its potential. The issues that we're focusing on are the issues in American healthcare. And I feel like with the talent we have here, there's a real opportunity for us both to do great work locally, but also radiate that much more broadly.
How would you describe your leadership style?
I like to think about empowering people to do and be their best. I think about setting really high aspirations for us in terms of the work we do and what we can achieve with our communities. And I set a pretty high bar on creativity and innovation around overcoming some of the challenges that we face.
Do you have one daily ritual?
At the moment, it's still bedtime stories. My youngest is 7, and I'm on my second tour through Harry Potter.
What's one misconception people may have about you?
That I'm more governed by my head than my heart. You know, I think a common perception is often people in administration are very focused on the business side of things. Whereas, you know, as a physician, I'm actually very kind of actually centered on like what is the impact we're having with the patients we're serving.
One wish for the future of healthcare.
One wish for the future of healthcare would be to eradicate inequities in outcomes of healthcare. Healthcare is always advancing, it's always going to progress. I think there's a grave injustice in the unequal outcomes, and everyone should benefit from that progress.